I was a little bit wrong on the last one. I said it was the last section. This will actually be the last section. It deals with being prepared for class, profiting from class, and being prepared for examinations. Also has a little bit of a change to it in that you're going to see a video of me from time to time or throughout. I haven't figured that piece out yet as I continue to learn all of the technology that we can use for this. So in addition to the reading of the slides and my comments with it, you'll actually get a chance to see me, which may or may not be a positive thing. Reading assignments are provided for every set of objectives that you're going to have and for each day of class that you're going to attend. And it is the expectation of your instructors that you will have completed that reading assignment before you attend class. The reading assignment is really to provide you with the background, with the knowledge that you need so that you can actually benefit from class. If you're going to be an active participant in that learning process, you have to have certain background information, certain knowledge that you already have so that you can extend beyond that and get the information and the value from the class and from the material that's going to be discussed and dealt with during the class. And it certainly is probable that many times you will not have understood everything that was in that reading assignment. We always have this sort of situation that as we begin a class and as you begin things, we don't always start with page 1 of chapter 1 of the book. We start somewhere further back. So some of the background that the book may assume that you have by the time you get to the 5th or 12th or 18th chapter, you may not yet have seen. So again, having done the reading assignment will put you in a position to ask questions at the beginning of class to help clarify that information and make sure you have what you need to benefit from the time in class. And it would be very helpful to go back then after class and after some of the expansion on and explanation of material has occurred, go back and relook at that information, relook at those reading assignments to help you process and again integrate that information together. And quite realistically, if you haven't done the reading assignment, it's going to be very hard to answer questions that you're going to be asked because again, as the classes progress, you're going to be involved in what's going on in class. And if you don't have the basic information and the basic knowledge, it's going to be really hard to answer the questions that are going to be asked and to, once again, be able to go beyond the basics of that reading. It also may interfere with your ability to ask questions you need to, because it's sort of like, well, I have this question, but maybe I was supposed to learn that from the reading, so I better not ask it. If you've done the reading, you may well know that what you have a question about was not covered in the reading, and you should be asking that question. And sometimes people get the feeling, well, I didn't get that reading done. We had class. I kind of understood what we went through in class and what we dealt with, so maybe I really don't even need to read that now. Well, not true, because there are going to be things that we don't spend time on in class that you need to have learned from that reading. So not being there, not having done the reading before being there can certainly limit your ability to understand everything that you're supposed to. Note-taking is another issue. People, again, have had a variety of experiences with note-taking. Your instructors will be providing you with some notes, but those notes are just a supplement to what you need to be doing yourself. And what you really need to do is develop a method of note-taking that's going to provide you with the type of notes that are going to be of value to you. There's no one right answer to this. There's no single way of doing note-taking. If it's something that you would like some assistance with, again, talk to one of us. The Academic Achievement Center does some classes, has people that can help you develop a method of note-taking that will work for you. But the important thing is taking notes is not a substitute for, it's not the most important thing that you should be doing during class. It's, again, to supplement, to help your learning. So it needs to be a value. It needs to be something that does not take your attention away from understanding, thinking about, and processing the information that's being presented in class. If you find that your note-taking is interfering with your ability to think about and process what's being talked about in class, that's when you need to think about, do I need to change or do something different here? The notes that you create need to be something that are going to be, to create notes that are going to be of value to you later that day, the next day, a week later, a month later. So kind of think about it from the standpoint of, how do I create notes that are going to be of value? You will be provided for each of the units. There are some PowerPoint slides that are made available through Blackboard. You can take a look at those PowerPoint slides, have that information to you that basically has what you're seeing on the screen in front of you here. And then in addition to that, you have room that you can make notes or write notes on paper if you do that with it, or onto an electronic form of that as well. It is my suggestion that you make time to review your notes from class within a few hours of having attended class. My experience has been that if I look at those notes a week later, I don't even know what some of the stuff I wrote meant. To me, it made sense at the time. If I had looked at it within a few hours, I probably could have still figured out what the heck I was trying to record or trying to write. And if you wait too long, then you may not be able to make sense out of some of the notes that you made. There are lots of ways that someone can decide to take notes. I'll list a few of those, and we'll talk about what might be the best way to do it. Some people said yesterday, some of the second-year students indicated that, if I write something on the board, you better write it down because it's important and you need to know it. And that may or may not be a good way to do it. I certainly say a whole lot more that is of value than the few things that I typically write on the board, but certainly some of those most important concepts do get written on the board, but don't limit your note-taking to only whatever gets written on the board. Others will say, well, write everything the teacher says. I don't think that's possible because we can talk a lot faster than we can write. So trying to record everything that way probably makes no sense. A few people have asked about, is it all right to record classes? Absolutely, as long as you have time to go back and listen to it and make sure that you then essentially take what I may be saying or what Larry's saying, put it into your own words, something that makes sense to you. Another way of doing it is write whatever seems new, something that, well, I kind of understand that, so I don't need to write that down. If this is new, maybe I should do that. I certainly had a few classes during my college careers over the years that, it's easier to take notes when you're awake, but there are times that one dozes off or attention wanders, and we may still miss a lot of things if we only record what we got when we were, fully engaged with what's going on. Again, the instructor has some responsibility to make the class somewhat engaging and somewhat interesting, but it's not our sole responsibility to do so. So my suggestion basically is that notes should contain information that helps you recall, remember the key facts, the key relationships amongst the information that was presented in class. As you prepare for the tests in the class, it's very important to think about the long-term reason for tests. They are a check along the way to provide some information for grading, not only information for grading, but to provide you a check of how well are you doing with understanding and learning the information that you should be learning. The test is going to ask you the most important aspects of the information that's been covered in the section that the test covers. And your goal. You really have two goals. One is to perform well on the test at the time that you take it. That may be done by either committing information to short-term memory or long-term memory. The ultimate goal is to become a great respiratory therapist, and to become a great respiratory therapist requires committing the information to long-term, not short-term memory. So what might work to get you through this test tomorrow or whatever day you have the test, actually being able to remember that information 6 months from now, 3 years from now, 10 years from now, is what's going to serve you in your career as a respiratory therapist. Many of us developed bad habits in preparing for tests, and a lot of that comes down to demands upon our time create a situation where we may do most of our preparation for a test in the last 24, 36 hours before that test is going to be taken. That, unfortunately, really encourages short-term memory as our primary focus of how do we remember the information for the test. Preparing further ahead of time is a much more valuable strategy. Spending some time most every day reviewing the information, thinking about the information, working with it so that we become comfortable with the information is the strategy for long-term learning, long-term memory, committing the information to long-term memory. Sometimes we get in a bind and we may have to do a significant amount of our preparation just before the test, but that should be a significant minimum of the time in terms of what we do. There's so many things that can interfere with preparation that last night or morning before the test. We need to be careful that we're not constantly depending upon, I've got to learn this tonight because I have a test tomorrow. Again, it's not a good long-term strategy, and there are too many things that can interfere with that last few hours or last 24 hours before a test. We also have a tendency sometimes, well, I have a test in respiratory therapeutics on Wednesday of this week, so Monday and Tuesday I'm going to spend as much time as I can studying information, working on things for that. I'll kind of let things for the introduction class and the cardiopulmonary therapeutics slide for a few days while I cram for the respiratory therapeutics test. Again, it's a strategy that is used, can be used, but it's not the best long-term strategy to use. Keeping up with things in all classes is easier, once again, if we have done some preparation ahead of the actual examination. As I said earlier, spend some time most days, every day if possible, but most days spend some time reviewing information, thinking about the information, trying to answer the objectives and the questions about it as best that you can. So again, after you've attended class, after you've preceded class by doing the readings and preparing the objectives, go back, look at those objectives, and reevaluate both the information that you've recorded with them and the information that was covered in class, and think about how would you now answer a question about that particular objective. If you find that you're not able to really answer the objective, what you put on the sheet when you submitted it, you've now attended class where we've talked about it, and it's still something that's not clear to you, how do I specifically answer that? You really need to ask a question at the beginning of the next class. The more you can quiz yourself and others, again, as frequently as possible, helps commit that information more into long-term rather than short-term memory. Something that's hard initially, but as you get more accustomed to your instructors and the way that they ask questions and the way they test, you can begin to anticipate the types of questions that you may be asked. And as you can anticipate those questions, you can be prepared to answer them. Keep in mind that there are a variety of types of questions. Many of the questions that you're going to see on your test will be multiple choice, but you're going to have some tests that contain no multiple choice questions and all short answer type questions, but you're likely to see some short answer questions on basically every test that you're going to take. So it's not a matter of just identifying the information among some options. It also involves composing and expressing ideas in more of a sentence form than just recognizing some basic information. The night before test, you should be doing only a final review. It should not be the bulk of your studying, as I've said many times here. For some of you, it can be difficult to show up to class the morning or early afternoon of a test that's to be administered because there's so many people cramming and trying to review last-minute facts and talk that can be confusing or can make it difficult for you to follow your preparation. So some people find that showing up very shortly before the test is to be given avoids some of that anxiety that may be produced when you hear a lot of people talking about various things that they think may be on the test. Sleep the night before a test. Rest is more important in many cases, if not at least as important, as cramming to success on the test. Again, cramming may be a workable situation in an emergency type of situation, but it's not a good long-term strategy. It's that issue. It can get you through this test, may get you through this, and it may work, but you have to go back, you have to spend the time, you have to do the work to learn the information for the long term, for where we need to go as a respiratory therapy professional. There are basic types of questions that you're going to be asked. The simplest ones are the recall, simply repeating back information that you have learned at some point. The next level of questions that you're going to see on your credentialing and also your exams through the program are the application, using that information that you have learned. And the primary type of question on your credentialing exams are going to be the analysis level questions, those that ask you to take several pieces of information, kind of reassemble them in a different way, or to make a decision. In general, making a decision with the information that you have is the essence of an analysis type of question. And to give you sort of some examples of a topic that we deal with in respiratory therapy, if we think of a recall question, you are going to learn the normal range for PaO2, the small a representing arterial blood, the P meaning pressure or partial pressure of oxygen. So this is asking what's the normal range for the partial pressure of oxygen in the arterial blood. You're going to learn that that's somewhere typically between 80 and 100 millimeters of mercury. A recall question simply asks you to remember that. An application question asks you to do something with that information. You might be given a set of arterial blood gas and pH data like is seen on the screen here. You have a pH of 7.22, a PCO2 of 58, and a PO2 of 55. So you need to be able to first off know that the normal range, as I said, is between 80 and 100 millimeters of mercury. Take a look at the data in front of you, see that the person has a PO2 of 55, and realize that that is below the normal range for PO2 and kind of figure out, based on if we had some additional information, you may be asked to figure out why is this person's PO2 below the normal range. You don't have, with the data presented in front of you here, enough information to make that determination, but you do have an ability to look at that PO2 of 55 and make a decision that, based upon that number and the normal range, and we can also take into account that this PCO2, although that's not the purpose of this question, but this PCO2 is elevated, which would increase in the PCO2 have some impact on the PO2, but not enough to bring it down from a minimum of 80 down to 55. So that's kind of the application level. The analysis level gets into, okay, we figured out what the problem is. What are we going to do about it? So if the above values were for a person who's breathing air, what should the respiratory therapist do? And what they should do, excuse me, is provide some form of supplemental oxygen therapy to bring that PO2 back into a normal range. Welcome to the last section of things that are going to be helpful to you to be successful in the program. We're going to look at several things here, how instructors and other students can assist you, and just some general things about general learning theory and some of the things that you're going to encounter as you move through the program. The instructors in the program, myself and Larry, want you to be successful, and we want to do whatever we can to help you be successful in the program. So no matter what you may hear, see, or other people may convince you of, it is our interest that you be successful in the program. The important thing to think about with that, or to be aware of with that, is the fact that it's up to you to put in the effort. Again, we've said many times that we cannot force you to learn anything. That is up to you. You have to put in the effort. You have to be willing to do the work you need to do in order for the instructors to help you. So your part is to do the reading, put in the time, put in the effort, work at learning and understanding the material, ask the questions when you're unclear on something, but do your part. The office hours are posted, but in general our office hours are basically any time that we're not in class. If we're not in class and we're in our office, we are accessible, the doors are open. The desire, once again, is to assist you in any ways that we can do so. There will be, and you'll get some information about this, there will be available to you enrichment labs, additional time that Larry or I or Amy or one of the other people that helps with the program will be available to help you, to answer questions, to demonstrate things, to give you that opportunity to make up any labs that you missed due to illness. And again, I cannot emphasize enough, ask questions. That's how you learn. One of the most valuable tools, one of the most valuable abilities that you should learn from this program is an inquisitiveness, a very acute sense of questioning. You learn by asking questions. Your instructors will also assist you in any way they can with learning the information, learning the skills and techniques that you will need as a respiratory therapist. A common thing of human nature is that we assume people understand and know things unless we have some information or indication that shows that they do not understand. So, again, to initiate this process, as I've said very early on, I'm not a mind reader. I'm not very good at picking up on subtle hints. I'm not that good at obvious hints. Make the contact, ask the question, request the assistance that you need. There's no real formal advising process here at DMAC that is established, but basically Larry and I are your advisors. As you proceed through the program, if there's any point in time where you are thinking about making a change, dropping a class, doing anything like that, it's not that we want to talk you out of doing something. It's not that our desire is to get you to change your mind about something. Our desire is to help you make the right decision, help you have the right information you need to make those decisions. It's not our place to make them, but it is our place to make sure you have the information you need. Dropping a class, even if it's not a respiratory therapy class, may have an impact on your ability to continue in the program without having to stop out and pick up a class before returning to the program. So please visit with us. Let us know what you're thinking. We'll share some information and thoughts and simply provide the information that we believe you need as you consider any changes that you may make. Any difficulties you're having, anything that affects your ability to learn is something that we want to know about, and we want you to stop in, catch us, talk to us at some point to let us know what's going on. The other students in the program can also be a big help to you. You can form study groups, people that maybe live or have live in similar areas, have similar interests, seem to be people that you have a connection with. If you can get together with a group of people and quiz each other and review information, it can be extremely helpful. There are a number of students in the second year group who are very interested in helping. There are some formal methods of setting up tutoring for any classes in which you would like additional assistance. Those are sometimes cumbersome. There are people who are very interested and willing to do this on a volunteer basis without any cost. So talk to me, talk to some of the second year students. People are there, people are interested in helping you. So those who have already had the class in the second year can be a big help. As I said, there are tutoring opportunities, some formal, mostly informal, that will be available to you. You can quiz each other about the information. You have been provided with some sample tests from previous years. Those can be helpful, but they're not everything you need. Just simply taking your objectives, taking information that has been covered in class recently, and quizzing each other over that material can be a very helpful way to learn. Discussing with other people the information that you're learning in class. The more you can use, discuss, talk about that information, the more firmly it gets implanted into your brain and into your memory. After you've completed the assignments, you're certainly not encouraged to share assignments to reduce your work, because again, that can be done. I know it's possible. I know it probably has been done by some students in the past, but you're the one who loses out. The work of doing the assignment, of finding the information, of synthesizing the information together, that's a big piece of where some of this learning occurs. But after you've completed an assignment, whether it be math assignment or anything else, if you want to sit down and compare the information you found with another student, that can be a very helpful way of helping to make sure you have the complete information, the right information, and it can provide an opportunity to just talk about it and again explore the information that you have found. You have the opportunity every time you're in lab to work together with other students as you're going to be learning the information, working with the skills, working with those abilities. Each and every time that you are in the lab, you can be working together with other students. It's nothing, again, people have said, you need to hear again, there's no competition within the program. Your grade is not based on how anybody else does. Your grade is based on how you do. So the more you can support and work together with each other, the better it will be for everyone. you're going to learn a lot of skills, a lot of techniques, a lot of patient care abilities. Practicing those, working with them together, having a group of 2 or 3 people, one to be a patient, one to be the therapist, and ideally one to sort of observe, watch the check sheet of the steps that you're supposed to be fulfilling, and then provide you feedback at the end on how you did with meeting each of the steps of the procedure is the way to learn it. It's what I've said before. You cannot learn to ride a bicycle by reading about riding bikes. You can't learn to perform arterial puncture by reading about arterial puncture. There's some things you need to learn from reading. There's some things you can learn from watching an expert do it. But for you to develop that skill requires actually performing the arterial puncture. So as you are being the patient, it's very easy to guide the person practicing the technique because you know or are quite familiar with what the steps are that they're supposed to be completing. So, the person getting ready to do aerosol therapy and you as the patient sticking your arm out to them to remind them that they need to check your heart rate and breathing rate and some of the other vital signs is not really helpful in the long run to their learning and remembering how to perform the steps of that procedure. The other thing is, it helps the person to give proper instruction if you try to approach your role as the patient from the standpoint of, I really know nothing about this therapy. I'm a brand new person to the therapy. I don't take deep breaths and hold my breath unless the therapist person in the practicing actually instructs me to do so. And realistically, the best way to learn something is actually to teach it to someone else. Throughout most of my college career and my early education in respiratory therapy, one of the more confusing things to me was the autonomic nervous system, that involuntary system that we have. There are lots of chemicals and lots of things that go with it. And I was asked to do a presentation, an in-service presentation to the respiratory therapy department where I was working, because it would help understand and help the staff to better understand the drugs and the medications that we were administering to patients. And it was really the first time that I firmly had the concepts of that autonomic nervous system in my brain that I could bring back whenever I needed it, was when I taught it to somebody else. So again, teaching it. If you have a dog or a small child that doesn't roam off, you can teach the information to them. They don't have to comprehend it or learn it for you to gain the benefit of teaching that information. Just a real quick kind of overview of some of the important things that we'll be dealing with as we go through the program. There are some basic domains of learning. When we had our information sessions, I talked about the fact you're going to learn in different types of settings. And there's different types of knowledge that you're going to gain. There is the cognitive domain. That's the information that you know, what you learn, facts and figures, general rules, the patterns that we see in somebody that has a breathing difficulty. All those are cognitive knowledge. So facts and figures, normals for various lab tests, what a chest radiograph should look like. Those are the cognitive domain. Psychomotor gets more into what you can do, and these are the skills, those physical skills and procedures that you're going to learn. They require manipulation, they require performing of techniques. It's when you're working with equipment and supplies. So all the things that you're going to do in your labs generally relate to the psychomotor domain, but they also support that cognitive domain, because hands-on things can help you learn all of the data that you need to know and all of the way the devices work. but the psychomotor is the skill of actually working with them, manipulating them, getting them to do what they're supposed to. Equally important to those two domains of the what you know and what you can do is really how you react to things, the affective domain. People do not get fired from jobs in healthcare because they don't have the knowledge or the skills. They lose jobs because they don't react properly, they don't interact properly with other people. So this really gets into your attitudes and the ways that you react to things, how your emotions affect the way that you behave with other people. A lot of this is going to be determined by your past experiences in life. It's really and truly a reflection of what's going on inside, internally, your emotions, your attitudes, your ways of reacting to what happens to you fall into this affective domain. And you're going to have things that we're going to do throughout the program that are going to impact all three of these domains and your learning in them.